Okay, our next speaker is Linky Levin. She's got over 45 years of experience in the field of psychiatry and addiction treatment. She brings all her experiences in the field of social work and psychiatry, and an amazing human being who's still working and still committed. The last 5 years she's been at Tranquility and Eden Recovery Center. I'm going to straight away hand over. Just give us a moment, please, so that we can get her slideshow going. Thank you.
Good afternoon, everyone. My name is Linky. Levin. Linky is how I'm known in the field of social work. As Gibson told you, I've got a long years of experience, and I'm going to talk today about the stigma and the family care and the aftercare with families once they have left rehabilitation. So the overview of my presentation will be Part 1, Stigma around substance use disorders, Part 2, Introduction to family interventions, and Part 3, Aftercare program. What does stigma mean, the word? Our society and previous generations from the old days used to see the alcoholic as a drunk man with a bottle in his hand, being abandoned and lying on a park bench. That was the image society and many generations before us had. In substance use disorder, stigma is any negative judgment towards a person who suffers from addiction due to lack of knowledge. As an example, family members will unite and discuss their relative as someone who is causing disturbance and chaos in their lives without the person's presence. In a community setting, the person who suffers from addiction might experience mob justice to punish the person for their behavior or behaviors rather than seeking help for them. Now we're going to talk the cycle of drug-related stigma. Consequences of stigma. Stereotypes happen when the family or the community label the addict as a dysfunctional person in their lives. This then leads to the merry-go-round of denial, where the person suffering from addiction remains in the cycle of not being seen or heard. I call it a merry-go-round because it's like a lot of actors in a play. One gets off the merry-go-round, one gets on the merry-go-round, and it seems to just go round and round, and nothing seems to come to a head. So in the education system, the job and relationship opportunities become minimal to the person who's suffering from substance abuse. The person's self-esteem then becomes negatively impacted, and they begin to believe the stereotype that they are in. So family interventions will be the next thing. Why is it important? Usually the family is the first to reach out for help once they are aware that there are organizations that can assist their loved one. That is through social media and even TV shows these days. We have our modular program on TV. A lot of people are seeing the kind of work that can be done through rehabilitation. In some instances, the affected family member might deny the problem and not want to seek rehabilitation. As a result, the family may ask for a family intervention with a healthcare professional to assist in the process of admission into a facility. In the family intervention, the goal is to begin the process of assisting the whole family, including the person suffering from a substance use disorder. Once the person affected by substances has been discharged, they go back into the family system. That's why the family members also need to be part of the recovery process. What does family intervention consist of? Family intervention is the supportive counselling that happens while the patient is in treatment in the rehabilitation centre. It starts with the collateral information that is collected from the family. It also includes regular phone calls by the patient counsellor to the family to update them on progress if there are any other issues. In some cases, if there are any urgent issues in the rehab centre that need to be addressed with the family, the counsellor will organise a family session to unpack the underlying issues and dynamics. In order to rebuild family relations, The patient and the family members are encouraged to communicate regularly with each other through phone calls. Family interventions. We have a 3-week to 5-week program, and then the exit meeting is a very major component of intervention with family and the substance user. The major component is the family exit meeting. The goal of an exit meeting is to start the reconciliation process between the patient and their family. According to the 12-step program, this is achieved by re-establishing trust and empathy within the family system. It is important to have a qualified and experienced professional facilitating the exit meeting, because in some instances the family members are so angry and they come in and say, where to from here now that my son or daughter has been in treatment, or even if it's a parent and children fetching them. And this might result in blaming and shaming the person in recovery, going back to the past. So in an effective exit meeting, it needs to be facilitated properly, otherwise it might cause unresolved problems to re-enter the family dynamic. What is aftercare? Once a person leaves the rehab, aftercare begins as a maintenance program. This is achieved by supporting them in their process of learning how to live a sober lifestyle. It also means rehabilitating the community by changing the stigmas associated with substance use disorders. What does aftercare offer? It reminds a recovering person about the 5 pillars of recovery. When they sign out of treatment, they write down their 5 pillars, which is part of the 12-step program, and they need to do their 5 pillars on a daily basis to maintain their recovery. We do this on a Zoom meeting at this stage, probably since COVID times. We have Zoom meetings every night of the week, and this is offering an opportunity for recovering individuals to support each other in an interactional process with a facilitator. And this gives a sense of community. It serves as an encouragement for the person to continue with the 12-step program, which is world-renowned and about 85 to 87 years old that this AA program has existed. In case of a relapse in the maintenance program, steps will be taken to guide the affected person back into recovery. Okay, so the thing of never walking alone again is what's important in aftercare, because in rehabilitation we teach them they're in a community of recovering addicts. And as I said, it's world-renowned in the AA and the NA program, which is a younger program. And we do want families to ask the addict in recovery, how do we go about getting into our recovery? There are Al-Anon programs, Al-Anon programs for families, there's ACA, Adult Children of Alcoholic programs, there's OA, there's NA, there's GA. All these things apply to families as well as the addict. If you want good recovery, everyone needs to really get onto the same page in learning the 12 steps together as a supportive unit. So that I've worked at Eden for the last 5 years, and I must admit that working here has created a beautiful spiritual side to all of us that work here or come here or get rehabilitated here, because it is a powerful, passionate style that they use at Tranquility Eden. Every counsellor and every person that works here gets involved with the patients on a compassionate level and assists them in their recovery process, from the CEO down to the receptionist, down to the social worker, psychologist, doctor and psychiatrist, as we've heard from all of them today with their technicalities that they have, and our new psychologist as well, Katleho. So we are very proud to have a multidisciplinary team which absolutely works as a dream team. We all need each other to work as a dream team member and not think that we own any of the clients or own any of the families. We don't. We all work together with each and every individual and family member. My experience in the field of social work, just to let you know, is that at a very young age of 20, I started working in the substance abuse field through Sanka for outpatient program. I went on to work for a mining community rehab, psychiatric and alcoholic care, because the mining community had a lot of addiction due to the stress working underground, which I did many clinics for them as well, going into their areas, for example, in Virginia, Harmony Mines or Welcome. We used to take a little plane and go there and assist people in aftercare. So I've always believed in long-term aftercare, not just walk into rehab and out of rehab. That doesn't exist. It has to be long-term aftercare in the maintenance program. I also had a long stint at another recovery centre for 15 years and at another recovery centre for 5 years. I've also worked at night in crisis centres and helplines, just to know that every day of my life I can pass on a good message. The whole message of Narcotics Anonymous, Alcoholics Anonymous, and care for people that are less functional than we are is to always want to help somebody else. Whatever stranger you meet can still become someone that you will care about. Each and every person is cared about and assisted on their pathway of recovery. There are no judgments, there's no precursors, everything is just one day at a time and going on that recovery pathway one day at a time, whether it be a marital divorce problem, whether it be alcohol and drug related, as well as marital and divorce issues. We work as a holistic team to work on all the things that need to be done in recovery. So I'm going to end with that one, and hopefully this has helped on a practical level. You've heard everyone else on a very learned level, and I hope this is meaningful for you and hope to meet some of you in the near future.